Regardless of where you work in the military treatment facility or your specific role within the unit, infection control plays an important part in the quality of care that we provide. Infection control practices minimize the risk and spread of infection and prevent and reduce the transmission of healthcare-associated infections. Managing the infection control program takes a team approach, and the most important part of our team is you. In this infection control training video, we will discuss healthcare-associated infections, standard precautions, transmission-based precautions, and bloodborne pathogens. A healthcare-associated infection is a local or systemic infection that occurs during admission to a healthcare facility but was not present at the time of admission. If you suspect a healthcare-associated infection has occurred, submit a patient safety report and notify the infection control officer. 4 of the common healthcare-associated infections include ventilator-associated pneumonia, catheter-associated urinary tract infection, surgical site infection, and central line-associated bloodstream infection. Healthcare workers play the most significant role in the reduction and prevention of infections acquired in the healthcare setting. We do this by strictly adhering to Air Force and medical group infection control policies, standard precautions, and transmission-based precautions. In 2014, the CDC released the results from its Healthcare-Associated Infection Prevalence Survey across U.S. hospitals and found that 1 in 25 patients, or an estimated 722,000 patients annually, acquire a healthcare-associated infection. Of those patients, about 75,000 die during their hospitalization, and healthcare-associated infections have increased healthcare costs by more than $28 billion. Among the potential healthcare-associated infections, multi-drug resistant organisms are of great concern because they resist one or more classes of antibiotics, thus limiting treatment options, increasing the length of hospitalization, and causing a higher incidence of mortality. Some examples of multi-drug resistant organisms include MRSA, VRE, and C. diff. The laboratory will make the necessary notifications and the PCM will flag the patient's electronic health record. The use of standard precautions apply to all patients regardless of their diagnosis or presumed infection status. Standard precautions apply to blood, all body fluids, secretions and excretions, non-intact skin, and mucous membranes. Standard precautions protects healthcare workers and prevents the spread of infection. Standard precautions include hand hygiene, personal protective equipment, respiratory hygiene and cough etiquette, the safe handling of sharps, medical waste, and soiled linens, as well as environmental cleaning. Hand hygiene is the single most effective way for healthcare workers to break the chain of infection. But surprisingly, many healthcare workers do not perform hand hygiene correctly. The proper way is to first wet your hands with water, apply soap and then working it into a lather, rub hands together for at least 20 seconds, covering all surfaces and focusing on fingertips and fingernails. Then rinse under running water and dry with a disposable towel. Then use the disposable towel to turn off the faucet. As responsible healthcare professionals, we should perform hand hygiene whenever our hands are visibly soiled, before and after every patient interaction, before and after removing gloves, before and after eating, after using the bathroom, and after touching equipment, furniture, or environmental surfaces in patient care areas. Remember, hand sanitizer can be used instead of soap and water if your hands are not visibly soiled. When you do use hand sanitizer, apply enough to cover all surfaces of your hand and rub your hands together until they're dry. To be effective, hand sanitizer should take at least 15 seconds before it dries. As part of standard precautions, personal protective equipment should be used as appropriate and includes gloves, masks, that is surgical or N95, eye protection, shoe covers, and gowns. It is important for you to know where your PPE is located, when to use it, and how to use it. Healthcare workers should practice respiratory hygiene and cough etiquette and teach patients and visitors to do the same. Respiratory hygiene and cough etiquette includes covering your nose and mouth when coughing or sneezing, sneezing into the inside of your arm, using a tissue to contain the secretions, disposing of that tissue immediately after use, and finally performing hand hygiene. Standard precautions also includes the safe handling of sharps. When using a sharp during patient care, be sure to use aseptic technique and follow the CDC's one and only campaign. That is to say, using one needle, one syringe, only one time. Also use single-dose vials when possible, and do not administer medications from single-dose vials to multiple patients. Finally, dispose of used syringes and needles immediately after use in an approved sharps container. Standard precautions also includes the safe handling of medical waste. Medical waste is the waste that is generated in the diagnosis, treatment, or immunization of patients. Wall-mounted sharps containers should be changed once they are 3/4 full. Then, seal the sharps container and label it with your unit's name and the date. Place the sharps container inside the biohazard waste cardboard box. The biohazard waste cardboard box must also be labeled with your unit's name and the date. Housekeeping will then transport it to the medical waste storage room. Solid medical waste should be placed in approved biohazard bags. The biohazard bag must be tied off. Then, place those bags inside biohazard waste cardboard boxes. Label the cardboard box with your unit's name and the date. Housekeeping staff will then transport it to the medical waste storage room. Liquid medical waste should be solidified using an approved solidifier. Then place the solidified medical waste into biohazard waste bags. The biohazard waste bags must be tied off. Then put the biohazard bags into a yellow, rigid biohazard waste plastic container. Label this container with your unit's name and the date. Housekeeping staff will then transport it to the medical waste storage room. The safe handling of soiled linens is also part of standard precautions. Before handling soiled linens, wear appropriate PPE, but as a minimum, gloves should be worn. Soiled linens should be contained in a laundry bag or designated bin and bagged as close to the collection site as possible. Do not shake soiled linen or handle them in any way that may aerosolize infectious agents. Finally, avoid contact with your body and personal clothing. Finally, standard precautions includes environmental cleaning. To prevent the spread of infectious organisms, healthcare workers must clean and disinfect equipment, furniture, and environmental surfaces in patient care areas using approved disinfectants. Cavi wipes are currently the approved disinfectant wipes to be used in all military treatment facilities and should be used in accordance with manufacturers' recommendations. When using Cavi wipes to disinfect, be sure to use enough to wet the surface and have a dwell time of 3 minutes before drying. Transmission-based precautions, also known as isolation precautions, are used for patients documented or suspected of being infected or colonized with highly transmissible pathogens for which additional precautions are needed to prevent transmission. There are three types of transmission-based precautions: contact precautions, droplet precautions, and airborne precautions. Isolation and contact precautions are used for patients with known or suspected colonization of infectious microorganisms that can be transmitted by direct contact with the patient or indirect contact with the patient care items and environmental surfaces. If a patient is placed on contact precautions, healthcare workers should wash their hands, then wear gown and gloves upon entering the room. Wear mask, eye protection, and face shield as appropriate when performing procedures. Then degown, deglove, and wash hands with soap and water just prior to leaving the patient's room. Isolation and droplet precautions are used for those patients with known or suspected infections that can be transmitted by droplets generated when a patient coughs, sneezes, talks, or during the performance of procedures that produce those actions. If a patient is placed on droplet precautions, healthcare workers should wash their hands, then wear gloves, gown, eye protection, and face shield immediately upon entering the patient's room. Then, just before exiting the patient's room, healthcare workers should remove eye protection and face shield, then degown, deglove, and wash their hands with soap and water prior to leaving the patient's room. Isolation and airborne precautions are used for those patients with known or suspected colonization of infectious microorganisms that can be transmitted by airborne particles that can be widely dispersed by air currents and over long distances. If a patient is placed on airborne precautions, healthcare workers should enter the anteroom and perform hand hygiene, then put on a gown, gloves, and an N95 respirator prior to entering the patient's negative pressure room. The 31st Medical Group has 4 negative pressure isolation rooms and are shown below. Bloodborne pathogens are pathogenic microorganisms which are present in human blood and/or body fluids and cause disease in humans. Some examples include hepatitis B, hepatitis C, HIV, and AIDS. A healthcare worker's risk of acquiring a bloodborne pathogen come from contact with blood, body fluids, splashes, and/or contaminated needle sticks during patient interactions. To prevent bloodborne pathogen exposure, healthcare workers should use standard precautions, wear appropriate PPE, follow sharp safety, including never recapping needles, using self-sheathing needles and needleless systems when available, and then discarding of those sharps immediately after use. Also, properly disposing of infectious waste and sharps, and cleaning contaminated surfaces and items. If a needle stick does occur, the healthcare worker should wash the exposed area with soap and water. If it was the eyes or mucous membranes, be sure to flush with copious amounts of water. Then you should immediately report the incident to your supervisor and report to your PCM with the source patient. If the needle stick occurs after normal clinic hours, call and go to the MSU for care. It is imperative that you know where to find your unit's bloodborne pathogen exposure protocol. Remember, infection control practices improve the overall quality of care we provide to our patients and help to maintain a safe working environment for our staff by minimizing the risk and spread of infection. Infection control is everyone's responsibility. If you see an unsafe or improper healthcare practice, speak up, because by doing so, you may be saving a life.